I'll start with a little bit of background. So approximately 1 to 2% of neuroblastoma patients have what we term familial neuroblastoma. And this means that they have a positive family history of the disease. Research in this area has identified two main genes implicated in familial neuroblastoma, and this is ALK and FOX2B. More recently, genome-wide association studies, or GWAS, have identified nearly 24 susceptibility loci in sporadic disease. And those are what we consider cases without a positive family history of disease. So with this in mind, we tend to think of neuroblastoma susceptibility as more of a spectrum. And despite these substantial discoveries, there are still gaps in knowledge due to the lack of parental data, which leads to an inability to definitively determine heritability. Through the Gabriella Miller Kids First Research Project, which is a program that supports large-scale genomic research initiatives in the field of pediatric oncology and childhood birth defects, we've sequenced a large and unselected population of neuroblastoma patients and parents. And this includes triads and dyads together with matched tumor DNA and RNA. In total, we have a large data set, including 556 patients with 457 triads, 99 dyads, all of whom underwent whole genome sequencing of their germline samples. Well over half of the cohort had tumor sequence with whole genome sequencing in 336, whole exome sequencing in 326, and RNA sequencing in 207. We then identified pathogenic or likely pathogenic variants in a pre-selected list of 197 cancer predisposition genes. And this large-scale study allowed us to identify rare pathogenic germline variants, and for the first time, definitively assess whether these variants are inherited or acquired de novo. With this data, we have made three key findings to date. First, we identified that 16% of the cohort harbors a pathogenic or likely pathogenic germline variant in a cancer predisposition gene. Second, we showed that the vast majority of these pathogenic or likely pathogenic variants are inherited at 94%, with equal maternal and paternal inheritance patterns within that group. And third, we discovered that the presence of a pathogenic or likely pathogenic germline variant is associated with worse outcomes in terms of event-free survival and overall survival in a statistically significant manner. These findings obviously heighten our concern for patients with such germline variants. However, this is a new finding, and the application to risk assignment, treatment decisions, and general counseling has yet to be fully evaluated. Additionally, we do not yet fully understand the function of many of these variants. However, this certainly warrants further discussion within the neuroblastoma community. Our findings have shown near universal inheritance of pathogenic or likely pathogenic germline variants. And we know from historical data that approximately 1 to 2% of neuroblastoma patients have a positive family history of disease. Currently, we are looking to investigate this observed varying phenotype between the patients who have the disease and parents who do not have the disease. We plan to utilize data from our neuroblastoma GWAS studies and performing a polygenic risk score analysis, which estimates an individual's cumulative risk of developing disease based on the contribution of these common variants. Our hypothesis is that patients will have a higher polygenic risk score than their parents, suggesting that it's a combination of common and rare variants that influence this tumorigenic process. In effect, we're looking to assess modifying factors that tip the scale in the direction of disease development.